Radiation therapy is a common treatment for cancer. About half of all cancer patients will receive it. One of the downsides of traditional radiation is that it can damage surrounding healthy tissue. At the University of Maryland Greenebaum Comprehensive Cancer Center, there is a different kind of radiation therapy that helps patients preserve who they are.
Please welcome the Gray Legend.
Paul Murray on the right has been singing with his good friend Russell Jones since the 1970s. They call themselves the Gray Legends. But in May of 2021, something was bothering Paul.
I had a little bit of a sore throat, just on the right side, and went up to the ear.
Antibiotics didn't help, so Paul saw an ENT.
And he scoped down the throat, and literally, when he saw the tumor, his reaction was, oh.
Paul had tonsil cancer. Time was of the essence, and within 2 weeks, he was meeting with Dr. Jason Malatoris at the University of Maryland Greenebaum Comprehensive Cancer Center.
Any problems eating?
Dr. Malatoris determined the tumor was inoperable, but Paul was a candidate for proton beam therapy, a special kind of radiation. This is the machine that administers the therapy at the Maryland Proton Treatment Center. The University of Maryland is the only hospital in the state that offers it.
Proton therapy is a unique way to deliver radiation for cancer patients, and it delivers the treatment slightly different than standard photon-based radiation does. It does this primarily by delivering protons into patients, and those stop when they get into patients and decrease the overall radiation dose that patients get.
So it's more targeted?
Correct.
Nearby structures in the throat are spared, including one that's near and dear to Paul.
One of the structures that we can spare with proton therapy is the voice box when we treat throat cancers. And so he is an ideal candidate for that reason to use proton therapy in an effort to be able to allow him to do what he loves to do.
Research shows proton therapy helps patients live longer. The Maryland Proton Treatment Center participated in a clinical trial of 400 patients with head and neck cancers. 91% of proton therapy patients were alive after 5 years, compared to 81% of patients given traditional radiation. Paul had proton therapy for 8 weeks and also received chemotherapy. Once it was over, his sister-in-law gave the avid Washington Nationals fan this.
This is my alter ego. We call him Nats Man.
Underneath all that Nats swag is a thermoplastic protective mask Paul wore while receiving proton radiation. For Paul, Nats Man doesn't just represent a baseball team. He is a symbol of survival.
If he's not at the head of the table, he's on the piano bench. And doesn't play well without the fingers, though, the hands. But he's part of our lives, literally. And I do mean life.
And yes, Paul is still singing, and there are 16 different types of cancers that can be treated with proton therapy, from brain cancer to breast cancer to prostate cancer.